Okay, I know you have seen these roles posted from hospitals, these jobs that say things like patient registrar or central financial clearance or patient access representatives. But what exactly do these roles entail? And is there a difference between one or the other? Let's talk about that today. We're going to bring on an expert. I want you to meet Phylicia. Mm, Okay, so if you're new here, my name's Jasmine Vealiz. I'm so happy that you've made it to our space. In this space, we were focused on alleviating the stress and confusion in the business of healthcare. And today we are talking about the role of a patient registrar in the emergency room, in the ER, in our US healthcare system. So I'm bringing on an expert, Phylicia Belfast. If you've never met Phylicia, you're in for a treat. She is quite knowledgeable in so many areas in our healthcare system. So let's welcome Phylicia to the stage. Yay. Hello, Felicia. Welcome
Hello.
back.
I'm very happy to be back.
So these roles, patient registrar, not patient. these these roles, ER registrar, central financial clearance, patient access representative, like what exactly are we even talking about here? What are these roles?
Thank you so much, Jasmine. I'm very, very excited. And I have been in the ER I've worked in the ER for about 10 years. So I'm very excited to give you guys some very, very good tips on ER registration, patient access, central financial clearance, which in all honesty, it's all the same thing. But the most important thing is that you are the first point of contact when patients come to the emergency room. And this is the perfect opportunity for someone who's never been in that type of ER setting, the setting that's fast paced, the setting that you get to see the various types of transitions of care. I'm here to help you.
I'm so excited. We've had someone reach out to us in our community because they have
Mm.
secured a role as a patient, as one of those things patient access rep, ER registrar, and they're excited, but they have zero experience in healthcare. And so I wanted to have a conversation with you and talk about what exactly do these people do when they're first being that first point of contact for patients in the emergency room. What takes place, and what are these folks responsible for day to day? And so, if you don't mind, could you share a little bit around what exactly these folks do in the emergency room and what's their day to day look like?
Absolutely. So, number one, let's start with the fact that an ER is an emergency room. So, you can expect the most critical, urgent things, right, will naturally come to an ER setting. So, be prepared for the types of things you will see. Don't be scared of the types of things you will see because there are tons of different people that are there to support every various area depending on the type of condition that walks in the door. However, as an ER registrar, you are the person that the patients come to that they need that type of guidance to help navigate through that healthcare system. So, the first thing as an ER registrar you're important for doing is collecting all patient demographics. That requires your ID, that requires your insurance card. There are billing aspects, which you can actually nowadays, the system will verify it for you in that EMR. But you have to make sure that you're collecting accurate data for patients because we have patients that have been there before, possibly, right? Let's say they have allergies. We don't want to create duplicate records because then there could be things that we miss that are quite important for that specific date of service. So we want to make sure that that continuation of care records are also accurate and up to date. And then we have that systematic flow so that we can also advise the patient next as to what's going to happen after we register them into the system. And normally, what happens after that, we'll have the patient sit in the waiting room. They'll next have a triage appointment with maybe someone that's clinical before they're actually seen by one of the providers. Those types of things you won't have to deal with. That's when we move into a clinical aspect. But you are the person that are there to help guide them, help keep them calm, help them understand what they can kind of expect next during their appointment, depending on the condition, right? Once again, it's an emergency room. Sometimes people don't have the opportunity to see you right when they arrive to the ER. They have to be seen by someone that's clinical first to assess that they're safe, to assess that they're able to communicate that information to you. So sometimes you may have to wait an hour, maybe a couple minutes, wait till family arrives, but go back and check. But the great thing about being an ER registrar is that it's repetitive. So if it's a field that you've never, ever been in before, it's a field that you can definitely learn, once again, the different transitions of where people navigate through the hospital. And it's also a great way to understand why it's important to capture accurate information for our patients as they're seen.
I love that. So thank you so much for sharing. I'm curious. You mentioned a couple of things there that I think we should chat about because you mentioned about the EMR system. So EMR meaning that the medical records for our patients. And when someone is a registrar, are they responsible for working in the EMR? Do they have responsibility of actually inputting information into the EMR, the electronic medical record?
Absolutely. Absolutely. And the great thing is with today's advanced technologies, right? I started when I was in the ER. This was, oh gosh, 15 years ago, right? When I did volunteer, we're talking about paper charts. We're not doing that anymore. So things are very electronic, and it's stored that way because we have a better security system. It's a better way to keep track of more of patient records all in one kind of stored system in place, because paper can melt, burn, you don't want to, we don't want to do that. And at the same time, it also allows for patients to be able to see their history and their kind of, assessments and next steps on an electronic end wherever they are, right? Whether that's home or out of the country, wherever that may be. But yes, when you patients arrive, you would put their name into the system. Of course, you'd have to first locate if they've been there before. If not, then we're creating a brand new chart. We're collecting ID, we're collecting insurance information, we're collecting emergency contacts. Maybe if that patient is employed, anywhere, those types of things are necessary. It will require them to complete registration forms, right, that they have to sign. Sometimes those are physical paper copies. Sometimes there are things we can't get away with even in 2025, but we're still growing. Those things would eventually be scanned in to someone more administrative, that maybe their role is just to scan in records, right? Because it all comes down to accountability at the end of the day, too, and acknowledgement of services that are actually being done so that we can appropriately file that to your insurance. So it's important that you utilize the electronic health records to make sure that we are accurately, once again, storing patient records so that they can move through the service in the
I
healthcare
love
system
that. Thank
accurately
you
and
so much for
appropriately.
sharing such great detail around what happens when the patient has their kind of intake information gathered, then knowing that there are other roles that they hand off to. So, like you said, if there's someone who's doing physical paperwork, that they are not necessarily creating a physical chart still, right? Things are still being scanned into the EMR is such important information to know when going into these healthcare systems these days, because it can
Mhm.
sometimes be a little confusing. You're like, oh, well, we definitely have paper charts, but no, we may not have paper charts. We might actually maintain everything electronically. We just have our patients signing off physically on documents because they don't have those loaded into like an e-signable tool. So this is so great. So when a person comes into the ER, they first see this individual, kind of, we'll call them the face of the emergency room. And they're the ones who are making sure this person has what they need to be seen by providers, right? So the best, I would say, thing about an emergency room function, if you're starting out in healthcare, it's very different than starting out in even though it might feel like the receptionist in the medical practice is also the face of the practice. It's a different style of environment. And in my experience, these hospital systems, because they have to maintain such volume and efficiency, oftentimes we find that the roles are reduced down to just a few responsibilities, because they know these individuals need to continue, like you said, repetition. They need to continue welcoming the next patient and the next patient. So they don't have as many responsibilities and tasks that need to be accomplished like our counterparts in the medical practices and the outpatient side, because those individuals, the receptionist can kind of have a lot of different hats and sometimes overlapping in areas that aren't necessarily reception tasks, like things that might be somewhat supportive of the triage team, or something that might be supportive of our billing team even, so there's areas that these receptionists in the private practice sector are a bit more challenged with. So I actually, and I don't know what your opinion is of this, Phylicia, but I actually, like, if I were to vote, the easier place to start would be ER, from the sake of learning the job. Now, obviously, you have the other side of it, which is what you shared
Mm,
before around like the
mm,
urgency of it and the critical. So share a little bit
yeah.
more about your feelings with that.
So, yes, I do agree with you. And I will be very, very honest. For, like I said, right, ideally, also for someone that's never been in healthcare, I do truly believe that starting in the ER is one of the best places to start, depending on where you want to navigate in healthcare. Number one, because the ER is the first outlet, of course, in urgent cases where you can see as patients transition, whether that's, let's say, someone needs to go to neurology, someone needs to go to cardiology, someone needs to go to geriatrics. There's so many different avenues that you can actually firsthand see. You can start networking with different people in these, different departments that maybe you can find a better interest to. And also, because it's a fast-paced, serious environment, I really do believe it helps kind of with your natural behavior, kind of how you handle stressful situations and conflicts, right? I was being in an ER for 10 years and currently now in family medicine. Of course, we're always going to have upset patients or things kind of naturally happen, but I've learned to kind of calm my demeanor, calm my character, which ideally that pours over into other people. So during stressful situations, while people are like, it's like, I'm still kind of just, it'll be okay. Why? Because I've been witness for the 10 years, helicopters flying around me and different things. And it was fun and it was amazing. But it taught me, even outside of work, how to kind of just chill, because mental health, all that is important. And it doesn't matter really which role, whether that's administrative or even clinical, that you get into, whether you even move into leadership one day, being able to maintain that demeanor, maintain your calmness is going to get you a long way.
For sure. It's such great advice. And we forgot to mention one really important thing. Not all emergency rooms are
Yeah.
created equal. And so, not necessarily saying that there's massive differences in the way they operate, not necessarily. However, there will be differences in volume and the nature of the patient visits. And so, Phylicia was actually in an emergency room in a city in Washington, D.C. And so, we have to share that because it's absolutely a different environment than what you might see in like a rural parts of the U.S. So definitely different types of cases that show up in that environment. Would you say, Phylicia?
I totally agree. Don't be scared. I promise you, once again, that we have tons of people that are there in various supportive roles that will help you. And it is 100% a team setting. There's no such thing as one ER registrar or one patient access, one central financial clearance. I mean, we have a family unit. So even when I worked in the city, that yes, the volume was massive, which was still fun and exciting to actually be a part of, because I actually felt fulfilled in my role, right? Helping people as they first arrive navigate kind of through the system, help them keep calm, help their patients and their family members when they arrived, kind of help secure their understanding that things are okay. It's amazing. It really, really is. So don't be scared, but I had fun. Yes, city life.
Exactly. And so my friends who are exploring this as an entry point, I hope that today's video helped to bring you some peace and peace of mind. We, as I mentioned, had someone in our community reach out because they wanted resources and information to help them build some confidence before they start. And so we're really excited to move into this series. We're going to talk a little bit more about the function of this role and hopefully help you guys feel confidence, and just know that what we talk about in these videos, even though we're talking specifically about emergency rooms, some of these same ideas and concepts apply to any other healthcare environment, especially if you're looking from the perspective of entry level and knowing that you want to potentially move up the ladder and continue to develop yourself into other roles and stay in healthcare for a longer career path. So Phylicia, thank you so much for being here. My friends, if you are not familiar with Phylicia, then you haven't hung around here long enough, which means you probably need to like and subscribe so that you can stay connected to our content. Also, we have trainings. Phylicia is actually about to drop her training for our front desk receptionist. And then we have a mini training that's going to be, we'll call it an introductory level training. So Phylicia has a program that she's releasing that's going to really help support folks that have zero knowledge and want to make an impact quick, right? And then we have folks that maybe want to move from where they are in healthcare to leadership roles. So these are all programs that Phylicia is focusing on. And we have our intro level programs that are programs that are going to help folks, break into the healthcare system and also help them identify whether they're in the right space. So